What we're going to do today is look at fertility treatment policies, and in doing that, we're going to think about time off. We're going to think about what sort of leave individuals might take for fertility treatment. We're also going to look at some case law. We're going to think about discrimination. We're going to think about surrogacy, because that is an option for somebody that is having fertility difficulties. So we just have a quick look at some case law around that. And then we're going to pull it all together and think about what should be in a fertility treatment policy. So let's just explore this time off in a little bit more detail before we move on to talk about case law. First of all, it's a medical appointment, so arguably we should treat it in the same way as other medical appointments. Now, there are certainly employers that argue, well, we shouldn't treat it in the same way because it's a choice. It's not a choice to have fertility difficulties, but it is a choice to go and seek help for that. So let's just have a little bit more of a explore about this issue of pregnancy discrimination. If the fertility treatment is IVF, and although IVF is probably the most common form of fertility treatment, of course it is not the only form, but in IVF, the embryo is fertilized outside of the body and then it is implanted into the woman. The woman has all the rights associated with being pregnant once that embryo has been transplanted.